Hello, my name is Felix Knauf and it's a pleasure to meet you here in this video. As a brief introduction, I also trained as a physician scientist combining residency training and a renal fellowship at Yale, where I could also do research then in epithelial transport as well as in immunology. And about 10 years ago, I started my own research group, continuing this focus on now tubular renal disorders. One focus of our research group is oxalate, so we'll examine how oxalate is absorbed in the intestine, but also in the kidney, and may accumulate and then cause kidney stones or chronic kidney disease. A recent focus has been the effect of oxalate on the cardiovascular system, and findings we made in mice have then really led to clinical trial now, an investigator-initiated study in patients where we use novel treatment approaches such as siRNA to lower oxalate production with the goal of reducing plasma oxalate and eventually reducing cardiovascular mortality in patients with chronic kidney disease. One additional focus has been to learn from individual patients with rare diseases, and we've identified an individual with a mutation of a sulfate transporter expressed in the kidney, and that individual was wasting sulfate into the urine and subsequently developing muscular and bone disease. And here at Mayo, we can now take advantage of identifying additional individuals. There's the large Mayo biobank, and it turns out that mutations of these sulfate transporters are much more common than known before. And in the next years, we're trying to identify these patients to characterize them. And in parallel, again, we're performing studies in mice where we test novel treatment approaches with the goal of eventually testing them in the infected individuals. So, to summarize, I would be happy if you join Mayo, or if you're interested also in our research, please reach out to me and we can have a separate meeting. And again, we'll be happy to welcome you here at Mayo. Thank you.